Well, good morning and welcome to the very first virtual event for Be Health with Sassy Ladies and Bees Girls Foundation. Why don't you like and share, tell everyone we're on, get our numbers up. This is a community event, so everybody can watch right now, whether you registered or not. So want to encourage you to make sure you share it with someone, share it on Facebook. If you're watching on YouTube, make sure you share it. We're going to give you the opportunity throughout the day to ask questions. This is going to be a very informative event. We've done this event at our East Campus in the past, but because of the pandemic, we are being wise and doing it virtually. So we're so excited that you're here. I want to welcome Dr. Wanda Mott, and so she's going to come on and talk just a little bit about what's going to happen today, and share with you why we're doing this event and why it's so important that you share it with others. Dr. Mott.
Well, thank you, Dr. Bridget, and it's so good to see you. We don't get to see each other anymore, and I'm so sad that we're not able to get to Love City and be together. But certainly we want to thank you and thank the Bee Girls Foundation for working with us on the Sassy Ladies Stimulating Healthy Lifestyles. Certainly we miss being in Love City, but we're here on Facebook Live and we're here on YouTube so that we can continue to understand what it is to be healthy and what we need to do to get ourselves to being healthy and living lifestyles and putting those lifestyles into action. So we want to welcome, certainly we were here last year. This is our second year. We want to welcome our students. We want to welcome our mothers. We want to welcome our grandmothers, because this is an intergenerational program so that we can change the health in our community. So we're going to have lots of fun. We meet on the first Saturday and it's 10 o'clock, and we appreciate you taking out the time to be with us. But we're going to learn a lot, and we're certainly going to still have fun, even though we're not in the Love City. So there are going to be prizes as we learn and go forward. So welcome.
Well, it's going to be a lot of fun. So as I said before, everybody share it with somebody. You don't just have to share it with your mother and your daughter. Share with your friends. It's a community event, so share with everybody that you know. This is the one good thing about virtual space, is that we get to involve more people than we even did when we were at Love City, because you don't have to leave the convenience of your home. You can just watch it here on the computer. So we're excited about the opportunity, and so excited that we're partnering with the Sassy Ladies and Dr. Mott and her team to bring you some good, healthy information.
Yes. And we just want to really thank you for taking the time out from your Saturday morning to be with us, be with Dr. Bridget, certainly with the Bee Girls Foundation, and with Sassy Ladies for this passport to stimulating healthy lifestyles. Now, certainly this is Breast Cancer Awareness Month. It's October. So we're going to talk about different health things that we can do to make sure that we are getting our community healthy. You know who you are. You are the Bees Girls Foundation. But who are we? We are the Missouri City chapter of Links Incorporated, one of 288 chapters in the continental United States, in the Bahamas, in the District of Columbia, and in the United Kingdom. We are about changing the health in our diaspora. So certainly we are 16,000 African-American professional women dedicated to the education, to the empowerment, and the success of our community. So that's why we're so glad to partner with the Bees Girls Foundation. Today, our Health and Human Services facet of the Missouri City chapter of Links will be educating and updating women in our community on breast cancer. All year long, however, we will be focusing on developing healthy lifestyles and eliminating chronic, preventable healthcare illnesses that have plagued our community for many years, and also chronic health disparities. So today, we're going to learn the basics of breast cancer. We're going to learn the basics of prevention. And then we're going to learn about treatment options and outcomes. You received when you registered a survey, and we'd like you to take that time right now to fill out that survey and send it back to us. Certainly, because we're not able to get together because of COVID-19, each month when we meet, we'll have a small snippet about what is happening with COVID-19 in our community. We live in Texas, ladies, and certainly there's a large number of positivity in our country. There are over 7 million Americans that have been positive, read positive for COVID-19. And unfortunately, over 207,000 have passed because of COVID-19. But the majority of those people are African American and Hispanic. So it behooves us as Black and brown women who are concerned about our communities and making sure that we are healthy to do whatever is necessary to keep ourselves safe. If we look at October 1st, there were 388 positive cases just in Harris County. So we are in the red. The governor is opening up many businesses, many restaurants, many bars, and we need to stay abreast of what the CDC is recommending for us. There are 4 basic things that we must do. We must wear face coverings. They need to be 2-ply fabric. They need to be washable. Certainly, they need to fit over your nose, your mouth, and under your chin. There shouldn't be any room on the sides. They should fit tightly to your face, not crushing it, but certainly there. You've seen in the community many people wearing the gaithers, which are those little collars that fit over your mouth, but there has been no indication that these gaithers are helpful in preventing coronavirus. Many people in the grocery stores will have face masks or shields on. Shields must be actually placed with face masks in order to decrease the incidence or the transmission of coronavirus. Now, hand washing technique is extremely important for prevention of transmission. And it involves 20 minutes of soap and water, washing the fronts and the backs of your hands and your nail beds. Now, I know that everybody won't be able to do that all the time, but make sure that the hand sanitizer that you get is 60% alcohol, because that's the only thing that will actually kill coronavirus. And certainly social distancing, the 6 feet or more, not less, distance, which are 2 arm lengths away from the next person that is near you, will help to decrease our incidence of acquiring this transmission. Clean and disinfect areas that you touch often. They're often touched by others. Those are doorknobs, they're countertops, they're computer forms, there are your keyboards. Use your discretion in making sure that you are cleaning these on a regular basis. And last but not least, check your own health. Check your temperature. Make sure that it's not rising. Check for shortness of breath, or certainly for headaches, for nausea, for vomiting, anything that is outside of your norm. And certainly if you're doing this, then we can, as long as you're staying out of public places on a regular basis. And I know the governor is opening up areas throughout our city and throughout our state. And so restaurants are open, but certainly the recent CDC reports that persons that have contracted COVID virus often have had an experience in a restaurant indoors. So certainly we all like to go out, but getting delivery is better. And certainly if you are going to go to a restaurant, make sure that you are sitting outside and your family is sitting outside, and you continue to practice social distancing, because this will help us to keep our families safe and to make sure that we are not victims of this coronavirus. So these are, and you can look on your comments to see other things that can be done that will help you in prevention for coronavirus. So now let's move on to what we came for. Let's learn about breast cancer. And we have two excellent physicians, and we will drop their bios into your comments as well, because they are extremely well trained and extremely versed, and they have a tremendous amount to offer. So we are very blessed to have Dr. Sophia Burns, who is an obstetrician and gynecologist here in Houston at the Legacy Community Health System. Dr. Burns, first I want to this is my link sister, so we close. Okay. So I just want to thank you for being here and providing us with your expertise and your education for the community. Dr.
Thank you. Thank you. All right. Good morning, everybody. I'm going to give you some breast cancer facts. Let me get my slides up. Is everybody able to see the screen? Oops, nope. Okay. So why is October Breast Cancer Awareness Month? Why did we designate an entire month to talk about this particular disease? Here are some sobering facts about this disease. In the United States, breast cancer is the most common cancer among women other than skin cancer. It is the second leading cause of cancer death in women after lung cancer. It is the leading cause of cancer death in women aged 35 to 54. And current risk estimates are that 12% of women, or 1 out of every 8 women, will develop breast cancer in their lifetime. And while it can occur in men, it is a rare disease for them, with approximately 2,300 cases per year for men compared to 230,000 cases per year for women. So let's discuss the basic anatomy of the breast. The breast is made up of several sections, 15 to 20. These sections are made up of glands called lobules that can make milk and have thin tubes called ducts, which carry the milk from the lobule to the nipple. The pigmented skin around the nipple is called the areola and has several bumpy appearances from the openings of these ducts that release the milk. If you look at this diagram, you can see that the breast has no muscle. It's composed of fat and connective tissue, the glands or the lobules, and the ducts. And finally, the lymph nodes, which drain from the breast into your armpit or your axilla. So what is breast cancer? It is when you develop abnormal cells or growths in most commonly the ducts, but it can also happen in the glands or anywhere in that breast. So people often ask, what is the biggest risk factor for developing breast cancer? And that is being female. Over 70% of women who develop breast cancer have no other known risk factor other than being female. But here are some other risk factors that have been identified in developing this disease. I'm sorry, I've just been told that you can't see my slides. Hold on, let's see what we can do. Can you see them now? A personal history of benign breast disease. This is things like having a history of ductal hyperplasia or complex fibroadenomas. A prior history of breast cancer, especially if that occurred prior to the menopause. Being older, your risk of breast cancer increases as you get older. Having a direct family history, a first-degree relative, especially if that person developed their cancer prior to the menopause. Your genes play a role. The BRCA1 and BRCA2 genes have been linked to about 5 to 10% of breast cancer occurrences. A history of premalignant breast lesions such as atypical ductal hyperplasia, lobular carcinoma in situ, or multiple papillomatosis. Having multiple relatives that are distant in your family that have breast cancer is also a risk. If you have never been pregnant, or if you had your first child after age 30, you have a slightly higher increase of risk for breast cancer. If you started your menstrual cycles before age 12, or you had your menopause after age 50, you have a slightly increased risk. Obesity. Being overweight not only increases your risk of getting breast cancer, it also increases your risk of breast cancer recurrence if you've already had the disease. Low physical activity. Research shows that 4 to 7 hours per week of moderate exercise will lower your risk of breast cancer. Research has shown that people who have more than 2 alcoholic beverages a day have a higher risk of developing breast cancer. If you have dense tissue on mammogram, this decreases the visibility and makes it harder for the radiologist to detect early small lesions. If you have a history of high-dose radiation therapy to your breast or your chest at a young age, people who have a history of Hodgkin's lymphoma or non-Hodgkin's lymphoma would fall into this category. And finally, hormone replacement therapy. The studies have shown that people who take combination hormone replacement therapy have a higher risk. Estrogen-only replacement therapy only increases your risk if you use it for 10 years or more. So race and ethnicity. Breast cancer is more common in whites than blacks. However, deaths from breast cancer are more common in Black women. Black women are disproportionately affected by more aggressive treatment-resistant forms of breast cancer, and they're usually diagnosed at a younger age. And the higher obesity rates in Black and Hispanic women and later diagnosis in both groups due to decreased access to health care are both increasing the risk of breast cancer in these groups. So breast self-examination. There are lots of screening modalities for breast cancer, but this is a way that you can check for changes in your breast that might signal breast cancer. Women who perform breast self-exam regularly find 90% of all breast masses. While 80% of all those palpable lumps are not cancerous, one can help detect potentially serious lesions by performing a regular self-breast exam. We recommend that you start at age 20 and perform a breast self-exam once a month, 3 to 5 days following your menstrual cycle. If you are after the menopause, pick a day that's easy to remember, like the first day of the month, and perform your breast self-exam on that day each month. Other ways of detecting breast cancer. Currently, the standard for screening is called mammogram or mammography. A mammogram uses low-dose radiation to create images that can detect tumors before they are able to be felt or palpable. It may also determine the need for additional studies on something that you can feel or see. 3D mammography, which is also called breast tomosynthesis, uses computer-generated images to assist in creating breast images. This technology is highly recommended, but you may have to request it. Ultrasound is another way to image the breast. Sound waves are used to bounce off of tissue and produce images. This imaging modality is very helpful in the evaluation of fluid fill or cystic lesions, but it's also used to help with mammography to evaluate further lesions that may be found there. It's also very useful in patients who have very dense breast tissue. And finally, is often used for guidance in interventional procedures such as biopsies. So what are some potential warning signs of breast cancer? A lump or thickening in or near the breast or in the underarm area, a change in the size, shape, or contour of your breast, bloody or clear nipple discharge, a change in the feel or appearance of the skin on the breast or the nipple, redness of the skin on the breast or the nipple without an infection, developing a spontaneous breast infection when you're not breastfeeding, and feeling a marble or pebble or rock-like area under the skin in the breast. So what are some common myths about things that can cause breast cancer? Taking vitamins or using underarm deodorant or antiperspirant, these things do not cause breast cancer. Taking medicines for osteoporosis, the bisphosphonates, or taking medicine to lower your cholesterol, the statins, these are not associated with an increased risk of breast cancer. Having mammograms after age 40 is recommended. It is not a risk factor for breast cancer. And finally, a history of terminating a pregnancy does not increase your risk of developing breast cancer. So when should you get screened? There's a lot of controversy that exists regarding recommendations for breast cancer screening, but the consensus between the American Cancer Society, the American College of OB-GYN, the American Radiology College, and the United States Preventative Task Force is get your first mammogram between the ages of 40 and 50. And then the frequency thereafter would be determined by you and your healthcare provider based on those initial findings. And one last thing, people often ask, what can I do to decrease my risk of developing breast cancer? Control your weight. As we discussed earlier, being overweight is associated with an increased risk of breast cancer. And the recommendation is to keep your body mass index below 28. Diet. Make sure your diet is loaded with fruits, vegetables, and antioxidants, and decrease the amount of fat, particularly saturated fat, that you eat. Exercise. As we discussed earlier, exercise has been shown to decrease your risk. The American Cancer Society currently recommends engaging in 45 to 60 minutes of exercise 5 days a week. Alcohol consumption. We discussed that 2 or more drinks a day is associated with an increased risk, so decreasing your alcohol consumption can decrease your risk. Smoking. Tobacco use is associated with a variety of health problems, but it has been shown to have an increased risk of breast cancer, particularly in young or premenopausal women. Finally, exposure to estrogen. We talked about hormone replacement therapy, This is something you would need to discuss with your healthcare provider, especially if you are having symptoms. But the more you can decrease your exposure to estrogen, you can decrease your risk of breast cancer. So I hope that these tips have been helpful. And now we have a game.
Yes, we do. Thank you, Dr. Burns, for all of the information that you've shared. And hopefully we will all be able to use that as we go forward in making sure that we're getting our mammograms, that we're getting evaluation, that we're doing self-breast examination as well. Link Jennifer has a game for us so that we can see if we can put the information that you gave us to good use. So Link Jennifer, take it away.
Sure. Good morning. Happy to be here. Can everybody see my screen? Okay. What you're going to do is you are going to go to www.kahoot.it. You're going to put in the game pin 1378928. And once we see, we're going to wait about 2 minutes and wait for players to join. And once we see you joining, we'll start the game. So again, you just want to go to www.kahoot, I see someone joining, .it, and then you're going to put in the game pin 1378928. And once we finish, we're going to have players coming in, and we're going to have a first, second, and third place winner. Welcome, welcome. I see players joining. Welcome. Okay, we're going to wait 1 more minute. I will read the questions and you will answer on your device. Make sure you answer on your device. I'll read the colors. About 1 more minute. 30 seconds. Join us, join us. Okay, I'm just waiting until 10:29. Okay, I'm gonna get started. All right, Tickle Pink, a breast cancer awareness program. True or false? In the US, breast cancer is the most common cancer among women other than skin cancer. Blue, true. Red, false. True or false? In the US, breast cancer is the most common cancer among women other than skin cancer. Blue, true. Red, false. Answer quickly. Okay, awesome. And Bree, you're at the top. Next. The greatest risk of breast cancer occurs at what age? Red, under 35, yellow, 50 and over, blue, 35 to 49. The greatest risk of breast cancer occurs at what age? Red, 35, yellow, 50 and over, blue, 35 to 49. Okay. It's anybody's game. Deslin, you're at the top. True or false? The breast is made up of 100 sections. Blue, true. Red, false. True or false? The breast is made up of 100 sections. Blue, true. Red, false. 7 seconds. Get your answers in. Okay, awesome. All right, we switch places. Next, most women diagnosed with breast cancer have red, family history of the disease, yellow, high stress levels, blue, lumpy breast tissue, or green, none of these. Most women diagnosed with breast cancer have a family history of the disease, yellow, high stress levels, blue, lumpy breast tissue, green, none of these. Didn't read fast enough, sorry. Awesome, none of these. Anybody's game. Next, true or false? One of the breast cancer risk factors could be distant family history of multiple relatives. Blue, true, red, false. One of the breast cancer risk factors could be distant family history of multiple relatives. Blue, true, red, false. Awesome. True. Okay, next. Which item is not known to have an effect on the risk of breast cancer? Red, alcohol, yellow, excessive weight, blue, preservatives in food, or green, hormone replacement therapy? Which item is not known to have an effect on the risk of breast cancer? Red, alcohol, yellow, excessive weight, blue, preservatives in food, green, hormone replacement therapy. The answer was preservatives in food. Awesome. Moving up. 3 more to go. BSE stands for red, best service ever. Yellow, breast self-exam. Blue, better start exercising. Green, brain surgery expert. BSE stands for. Answers coming in. Awesome. Breast self-exam. Okay, moving on. Which of these has been proven to increase breast cancer risk? Red, cell phones. Yellow, underwire bras. Blue, antiperspirants, or green, none of these. Which of these has been proven to increase breast cancer risk? 3 seconds, 1 second, and good. None of these. Awesome. Which U.S. ethnic group has the highest rate of new cases of breast cancer? Red, white, yellow, Hispanic, blue, African American, green, Asian. This is the highest rate of new cases of breast cancer. Red, white, yellow, Hispanic, blue, African American, green, Asian. Yes, new cases are white. Last question. Anybody's game. Whoa. Last question. At what age does the American Cancer Society recommend that women begin yearly mammograms? Red, 30, yellow, 40, blue, 35, or green, 50? What age does the U.S. Cancer Society recommend women begin yearly mammograms? Red, 30, yellow, 40, blue, 35, green, 50. Awesome. Woohoo. Let's see who our winners are. Podium. 3rd place, Bree. Make sure we get your information to Pastor Hilliard. KR, 2nd place. And 1st place, 9 out of 10. Wow, good job. Make sure we get your information. We have a $50 gift card for 1st place, $25 for 2nd, and $15 Amazon gift card for 3rd place. Thank you for playing.
Jennifer. That really went well, and certainly all of our ladies were really playing to make sure that they had gotten the information. So we'll continue to do things like that to bring the information forward so that we can make sure that we're embedding it in our minds and it becomes a second nature to us. So now that we've learned the basics, let's go on and learn some information about treatment when someone in our families or one of us actually contracts breast cancer. We have Dr. Olunchi Oki, who is an assistant professor at MD Anderson in breast oncology, and we'd like to bring Dr. Oki on. Thank you so much for volunteering your time. Dr. Oki is on call today, and she has volunteered to come. She has family, she has a lot of other responsibilities, but she's really interested in sewing into our community. So thank you so much for being here.
Thank you so much for having me. So today I wanted to just speak with you guys about, some of the potential treatments that you or your family member or someone you may know may undergo if they were to contract, breast cancer. And one of the things I want you guys to leave here after I've given you my talk is to know that, there are options. I think there are a lot of myths out there, a lot of speculations out there that, when you have breast cancer, it's either this way or that way. However, there are many options now. Things have changed quite a bit over the past decades. And, patients have a lot of options. And the goal is to, nowadays, do the minimum amount of, treatment, whether it's invasive versus, actual, chemotherapy or other treatments to still try and cure the patient. So one of the first things that I wanted to kind of highlight and, make you guys take note of is what Dr. Burns says. It's to encourage you guys to go out there and get your mammograms. I think the biggest kind of fear for people getting their mammograms is, they're concerned about risk to exposure to radiation. However, if you see someone who gets mammograms yearly from age 40, the amount of exposure to radiation that they get every year with a mammogram totals the amount of, one CT scan they may get for something acute they may go into the emergency room for. So I just want to let you know that the risk of exposure to radiation is low. And the reason going to get your mammograms is very important is because of early detection of breast cancer. I cannot stress that early detection of breast cancer is very, very important. And the reason for that is because the majority of breast cancers that are detected early, meaning we find a smaller tumor and it has not spread to the lymph nodes yet, is very curable. We cure over 90% of breast cancers that are found early stage. There are different types of breast cancers, and so there are different types of treatments. So I wanted to discuss that with you guys today. I think when I meet my patients, one of the biggest things they are afraid of when it comes to surgery is they think they have breast cancer, and that means that they're going to have to remove their whole breast. And I want to let you know that that is not always the case. A lot of times people have options just to remove the lump. And I guess the next question I get is, well, if you remove the lump, does that mean that my breast will be asymmetrical, meaning one side will look like it has some parts missing? However, in most cancer centers, not only do you see a breast surgeon when you first come, you also see a plastic surgeon, and there are other ways to, make your breast look symmetrical after having your breast lump removed. If you just remove the breast lump alone. And so I just wanted to highlight that. And it doesn't require things a lot of times like, implants and things like that. It just requires some rearrangement of fat within that breast for it to look the same. And then so I think a lot of people are worried about not only the cosmetic outcome afterwards of what their breast will look like, well, also is removing the lump just as good as if I would have removed my whole breast. And I want to say that, yes, we've done a lot of studies to show that if someone comes in and they have just a lump, they can remove the lump as long as they get radiation treatment afterwards, removing the lump. It's equivalent to as if they remove the whole breast. And so the outcomes are the same, the chances of cure are the same. So if you know a family member or you yourself get diagnosed with breast cancer, see what your options are for surgery. There's many different options now. It's not just, having to remove the whole breast. And I think that's one of the biggest things that a lot of women especially are very worried about if they were to be diagnosed with breast cancer. um, there are also ways that if you're not a candidate for just removal of the lump, to become a candidate to be for just the lump to be removed. And one of those ways is to get actual treatment, whether it's chemotherapy before the actual surgery, um, just to be able to shrink the tumor. And a lot of times that can make you a candidate for just removal of the lump rather than having to remove the whole breast. Um, and then so one of the other things I get from my patients is, you know, I'm part of the reason I didn't want to come in, or I was afraid of what you were going to tell me, is that you were going to tell me that you needed chemotherapy. And for some cases of breast cancer, we do recommend chemotherapy. Chemotherapy in certain types of breast cancer have been shown to, be what we need to actually cure people. However, there's the most common type of breast cancer is the one that is called estrogen and progesterone, or hormone positive. And that's the breast cancer where the hormones you make, meaning the estrogen and progesterone you make, can feed the cancer and make it grow. So actually, in those types of breast cancer, if they're caught early, we can a lot of times avoid having to give chemotherapy to patients if they're caught early. And the only treatment they get is an anti-estrogen pill that they would take once a day for about 5 years after surgery. And it's just an estrogen suppressing pill, and it's not chemotherapy. Of course, all pills have potential side effects, but all the times these side effects are more bearable. And again, it's a pill we recommend for 5 years, so a majority of patients tolerate it. And so again, that's why it's very, very important to get your mammogram and try and find the breast cancer early, because about 60 to 70% of breast cancers are that estrogen and progesterone positive type. And, if all you would need is surgery and then to take an anti-estrogen pill afterwards, that's the most minimal treatment that, we recommend for a lot of patients these days who catch it early. And then so I just want to highlight again and stress the need to get mammograms early, because it's very, very important to detect the breast cancer early. There are some situations where, not only do we need to give patients the anti-estrogen pill, but patients will need chemotherapy. A lot of times when we give chemotherapy, we give it up front, and the patients who need chemotherapy usually need it before surgery. The reasoning for giving chemotherapy before surgery is because a lot of times, one, we want to, sometimes shrink the tumor to be able to make a patient a candidate for just removal of the lump and not have to remove the whole breast. That's one reason. However, the second reason is, and the more important reason, is because it's usually when patients have had breast cancer that have already spread to the lymph node in their armpit close by. We want to contain the spread and try and make it not spread any further. And so we recommend usually giving chemotherapy up front to try and not only shrink the tumor, but also contain the spread. And then a lot of times that's safer for patients. And then they go on to surgery afterwards. And then a lot of times the reason we also give chemotherapy up front is not only just to contain the spread, but it's also to have to limit the amount of lymph nodes they have to remove at the time of surgery to decrease your risk of something called lymphedema, which is swelling of your arm due to removal of potential lymph nodes. And if we can minimize the amount of lymph nodes we need to remove, then the chances of having that is very low. And then so those are the two most common reasons as to why we would give chemotherapy first. Again, chemotherapy is one of those things where a lot of times when people have come and they tell me stories of family members or friends that they know have gone through chemotherapy maybe 10, 15 years ago, or they've seen, potential side effects that they've seen on TV. They always wonder, am I going to be sick all the time? Nowadays, especially for breast cancer, there's been a lot of research in breast cancer. We have a lot of research to show what we can do, whether it's giving you IV medicines before your chemotherapy infusions, or certain medicines that you'll have equipped with your at home to help to combat any of the side effects. So nowadays, majority of my patients are getting chemotherapy and still going to work, are still able to do what they usually need to do at home. And it's because nowadays we have a lot of what we call supportive medicines to help patients to be able to go through chemotherapy. And then so I think that's been the biggest change that you've seen, is now we're focusing on those things, is that trying to get patients a lot of supportive medicines that will help them with any side effects that they may have, or letting them take them ahead of time to prevent the side effects. And a lot of patients now are able to really go through chemotherapy and not really have as significant side effects. And then I think the other thing, especially now during COVID-19, a lot of patients are worried about is, if I get chemotherapy, won't that suppress my immune system? And won't that make it so I'm more susceptible to COVID-19? However, the majority of the chemotherapy regimens we give for breast cancer, we also give either an injection or a patch of a drug that actually boosts your immune system and boosts the infection fighting cells in your bone marrow to help you fight infections. So a lot of times, patients who are undergoing treatment for breast cancer and undergoing chemotherapy actually have more infection fighting cells boosted than the general population. And so a lot of times they are actually quite covered because of the medicine now that we give them for breast cancer, or for their chemotherapy treatment. And then, so those are the different modalities that we kind of use in treating breast cancer. One of the last things that I quickly mentioned was radiation. So radiation treatment is usually used after surgery to try and decrease the cancer from coming back within that same breast or the armpit area close by. Radiation is I know many patients are very, afraid of radiation, affecting the nearby structures or nearby organs of like your, lungs and things like that around your breast. However, again, radiation has changed quite a bit. Radiation is much more precise, that it really targets just the breast. A lot of times now you see less likely that patients are going to have any side effects in their lungs or nearby organs from radiation. There's also emerging therapy, something called proton therapy, which is not radiation, that puts you at even less risk of any surrounding organs being affected by the treatment, but still being able to decrease your risk of the breast cancer coming back. And then so those tend to be our three modalities of treatment. So surgery, either chemotherapy or anti-estrogen pills, or something called targeted therapy for another specific type of breast cancer, and then radiation. And then so that's what we normally use for people who come and are treated for breast cancer when it's found earlier, so early stage breast cancer. However, there are some people that unfortunately it does come at a point where the breast cancer is spread to other organs. So we call that late stage or stage 4. However, there's been also a shift in the way we treat, stage 4 cancers in general. And the shift has been that instead of, what they used to do before was, blast people without chemotherapy, patients would get really sick, and people were not able to withstand the treatment for a long time. So the treatment itself was harder than the cancer on the person's body. That has changed completely. We do not do that anymore. Now we've developed a lot of new drugs that are actually a lot of times pills, sometimes targeted therapies, and not even chemotherapies, especially in breast cancer. Breast cancer being one of the most common cancers in the United States, has had the most research funding, and it now has probably the most FDA approval of drugs. And so now we have a completely different way of treating breast cancer. And a lot of times we can avoid using chemotherapy for patients who have breast cancer that have spread, or stage 4 breast cancer. And even though those patients, we have no cure for them yet once breast cancer has spread, we do have a lot of treatments to help contain it for quite some time, and also to prolong their life as long as we can. And those treatments, a lot of times, are not chemotherapy, or if they are, they're one chemotherapy at a time, so it's not as strenuous on the body. And the goal is for longevity, meaning like being able to sustain treatment for a very long time, to be able to withstand it, and having a lot of options for the treatment as well. And then the last thing I want to talk about is some emerging therapies, and something that you guys may have heard of is something called immunotherapy. It's being studied in breast cancer. It's a drug that's actually trying to use your own immune cells or immune system to fight the cancer. So there's a lot of clinical trials that are showing really great results from these drugs. So if you or anyone who knows someone with breast cancer, let them know to ask their doctor, are there any clinical trials where they can be involved in getting the immunotherapy drugs with their standard of care, because we're trying to see a lot of promising results with that, and in not just breast cancer, but in other cancers. And we're thinking immune therapy is going to be the next wave that really helps us, cure hopefully breast cancer that's spread and other cancers. I do want to say one thing that was updated yesterday. We did see that in not breast cancer, but in something called Hodgkin lymphoma, which is different, that we're seeing that adding immunotherapy to the current treatment that was used for Hodgkin lymphoma, that over 5 years, everyone was cured. And so now we're thinking that adding immunotherapy to different cancer treatments in different cancers may be what we need to use to cure more people. And so we're hoping that more and more research can be done, and we invite a lot more people to get involved in clinical trials. I think a lot of people are afraid that they're going to get placebo, but there are a lot of clinical trials where you actually get the drug, including immunotherapy. And so we invite people to get involved in that, because especially with African Americans, a lot of them are not enrolled in clinical trials for many different reasons. And so to be able to learn about the biology of the breast cancer in African Americans versus non-African Americans would be great, so we can cure more of them, since it seems like more of them are getting, unfortunately, passing away from breast cancer more than white women. So that's kind of the different modalities of treatments we have. I'll be happy to take any questions later when it's time. Thank you.
And certainly we will have a question and answer, and we'll ask people to put those into the comments now for questions for Dr. Oki, and for certainly Dr. Burns as we go further. We're going to try to put a little of that information that you gave us into a game. So Link Sharon is going to give us an opportunity to do just a few minutes to see how much of that information she gave us did we really absorb. Let's go, Lee Sharon.
Thank you so much. I want us to have a little bit of fun right now. So what we're going to do a scavenger hunt. And this is how the scavenger hunt is going to work. After you get the item that we ask for, you're going to take a picture of the item, and you're going to put your name and the picture, and you're going to text it to 832-795-4756. Okay, that number again is 832-795-4756. And let's get started. So I'm going to give you the list of all the items that we're looking for. The first item, if you can find it, take a picture and send your name to the number. The number should be in the chat box. Either a pen, or a bracelet representing breast cancer awareness. It could be either or. The second thing that we would ask for, if you remember from last year, we had these wonderful hang tags showing you how to give a self-examination. Okay. That's the second item that we're looking for. The third item, we want a photograph, an intergenerational photograph with at least 3 generations of females from your family. A photograph, an intergenerational photograph of 3 generations of your family. So let's get started.
How much time do they have?
They're going to have 3 minutes. I'm sorry.
Okay. You got 3 minutes to go. Bring them up as fast as possible.
Again, we're looking for a pin or a bracelet. We're looking for the hang tag for the shower. And we're looking for a photograph, an intergenerational photograph of at least 3 generations of females from your family. The number that you're going to text the items along with your name when you have them, 832-795-4756.
So I'm sure everybody's looking throughout their household for these things.
We're getting a little cardio in today as well, right?
Exactly. We're getting everything in today.
Exactly.
So we can be ready to go. That's right.
We got about 2 more minutes.
2 more minutes. So
the number again, it's on the screen, 832-795-4756.
You know, that scavenger hunt, the picture that you were talking about, that really gives people an opportunity to see that talking about your family history is so important in letting people know what has happened. We have a tendency in our community to want to keep everything under the cuff, but certainly in our families, we need to share. We need to share that someone had breast cancer, or they had a lump, or they had something removed. It's not a reflection of anything that they did wrong. And oftentimes it's something that's inherited. So if we can start thinking of our families as an extension of us, then we'll do so much better in getting healthy lifestyles and not having to deal with these problems with breast cancer.
You know, Dr. Mott, I completely agree with you. In my own family, I've found as I've gotten older and I've gotten checkups for this or that or the other, when I mentioned it, then it was like, oh yeah, Aunt so-and-so or your cousin or what have you. And it was like, if I could have known this before, I could have approached my healthcare a whole different way. So it's surprising, but I think that you're right. Maybe back further in the day, people didn't talk about it because there may have been shame associated with some of the things that we experience as women.
Yeah, but I think that we certainly in working with these girls and Sassy Ladies and understanding about healthcare and making sure that we're moving through healthy lifestyles, we're leaving all that stuff behind. We don't do anything. We don't have any shame. Okay, there's no shame for having this in our families. It's just something that we have to deal with and make sure that the other girls and the other women in our family don't have to deal with it.
Yeah. Exactly.
I think we have a winner.
Are we ready? Let me see. I'm sorry, I got carried away. All right. Then let's say that we have a winner, and the winner's name is Marcella. Marcella, so make sure we have all of your information so we can get your gift to you.
Yay.
Thank you so much, ladies. Good job.
Fantastic. So which ones did she bring up? Do we still have the other two?
I am looking to see, is there indicate she had all the items?
Whoa.
She had all the items. That's awesome.
Okay, so she gets all the gifts. So what gifts does she get, Miss Sharon?
We are going to be giving her a gift card, I believe, and we will get that to her as soon as possible. Okay?
Oh, fantastic. All right.
Thank you all.
All right. So now, certainly we've learned a lot. We've absorbed a lot. And we just want to take one of the things that we want to do with these opportunities to come together and talk about health. Sometimes it can be very overwhelming, especially if you've had people in your family that have had these diseases. But right now, we just want to spread some information around and make sure that everybody in the community is enjoying themselves. All learning does not have to be painful. And certainly when we take it away to other people in our family, because we're expecting you to go out and talk with others about these same things, certainly helping them to do self-breast exams and seeing how important those are, and certainly sharing information with their families. So we're inviting you back next month because we're going to talk about living healthy lifestyles in linkages to life, and certainly food variations, because what we eat determines who we are and how long we live and how well we do. So certainly we're going to move forward to giving some actual gifts to multiple people here, and we have our survivors, and we have survivors here that have volunteered their time to come to us and just share. Because a lot of times when you think about breast cancer, you think it can never happen to you. It won't be me, okay? But many people in their 20s, their 30s, their 40s, and certainly much older have developed breast cancer. So I'd like to bring on Linda. I would like to bring on Chanel Williams, one of our Link sisters who experienced breast cancer. And I'd like for her to just take a moment to be transparent and tell us about her experience. And thank you so much for coming.
Oh, of course. Good morning. Can everyone hear me? Okay, so my name is Chantel McWilliams, and just like Dr. Mott said, I am a breast cancer survivor. I was diagnosed at the age of 37. I was a 2-month newlywed and had just moved to Houston. So I was really just living my best life and very excited about being in a new city and starting my new life. And just on a whim, I was putting on lotion one day and I felt something. And to be very transparent, it took me a few weeks before I even told anyone. I was ashamed because I didn't know what it was. And so I just ignored it. You know, we're busy. And so I just really ignored it. And then my mother came in town and I asked her to feel the lump that I had on my breast wall. It wasn't even on my breast. It was on my breast wall. And she's a nurse, so she suggested that I go and get a mammogram and go to MD Anderson and get a mammogram because they have an undiagnosed clinic. And so that's what I did. And I went in on a Wednesday. I was diagnosed with triple positive, HER2 positive, stage 3B breast cancer. And it completely changed my life. It was a Wednesday. I started chemotherapy on Sunday. And my cancer was very aggressive. So I had to have 6 months of chemotherapy, 6 weeks of radiation therapy, a full mastectomy, and I've had 2 surgeries. In addition to that, I received a condition called polymyositis, which is when your muscles begin to break down due to the breast cancer, and which means I'm going through chemotherapy and I can barely walk. So I had to get additional treatment in addition to the chemotherapy treatments and everything else that I was taking. So I would just really urge women and men, if you feel something, go to the doctor immediately. I just keep thinking if I had continuously ignored that lump, I probably would not be here today because my cancer was very aggressive. I don't have any family history. I was very healthy. I worked out. I didn't drink 2 glasses of wine a day, but I did drink wine. But I felt like I had a pretty much healthy lifestyle. And so it really, to be very transparent, it's a very skeletal experience because you are broken down to the core, and how you are spiritually and emotionally will determine how you fight breast cancer. So you really have to isolate yourself to really heal emotionally and physically, because it is very difficult. It was very difficult for me. I felt very defeated because I didn't see any African American women surviving and thriving breast cancer. Everything I heard and saw was people who had passed or died. So I was afraid. I just assumed that was going to happen to me. So my story was not that. I'm still here. I'm living my purpose. And my passion and goal is to always educate other women and men about breast cancer and being their own advocate. So I hope that my story will help someone today.
Thank you. Thank you so much. Thank you so much, Link Chantel. Thank you so much. You shared with us last year. Some of you may remember her. And we thank you again for joining us. So now we're going to hear from Shannon Holly Coleman, and she's going to share her story with us. Shannon? We can't hear you. Take yourself off mute.
Sorry. Hopefully everyone can hear me now. Good morning. Thank you so much to Bees Girls and Sassy Ladies for having me here and for doing this program for all of you in our community, because it is so important, especially during Breast Cancer Awareness Month. I'm Shannon Coleman, and I am a survivor of breast cancer. I will say I am surviving because I am currently in a 5-year treatment program, so that through medicine. And I felt like when I was listening to Dr. Oki, she was telling my story. And so I will kind of put a face to that story for you. I was diagnosed in December 2016. I was 48 years old, and I was diagnosed through a routine mammogram. Like our last speaker, I was kind of in shock because I didn't feel sick, and it wasn't anything that I was able to feel through a routine breast exam or a self-exam. It was something that only showed up on mammography. And so I was with my local doctor. I lived in Illinois at the time. And when they told me, I was kind of in shock because I was like, well, I'm not sick, and cancer equals sick, so I don't have cancer. But I knew enough that this word was scary, and so I knew I couldn't ignore it. And the only thing I knew to do was to call MD Anderson. I was raised in Houston, my family's in Houston, and so the only thing I knew about cancer was MD Anderson. And I'm so glad that I did. They have a self-referral program. You call a 1-800 number, and you just tell them, I need help. You know, I've been diagnosed with cancer, and I don't know what to do next. And if I have any advertisement, it's for MD Anderson's program. They were so caring and so compassionate that I called them. I was diagnosed on December 6th. I called them on December 7th, and I had my first appointment there on December 18th. So they confirmed the diagnosis. They spent so much time with me explaining what it was. I was very early. It was tiny. That's what they called it. I don't know if it's a medical term, but they said it was tiny, and I thought that was great news. So I had a lumpectomy. And when the doctors tell you that you do have options, and it's not like the things we used to see in movies or on TV, the advancements in breast cancer are pretty astonishing. And I think it's because of all the research and all the funding that this cancer gets. They know that if you have this particular kind of cancer, this is the treatment that will be best for you. And so once they were able to confirm my cancer and that it was small, it was a stage 1A. It was invasive ductal carcinoma in situ, meaning that it was in my tissue. But once I had my lumpectomy, which was my choice, and it was the right choice for me, but again, it's a very personal cancer, so only you know what's best for you in consultation with your doctor. So I chose a lumpectomy. It was in my left breast, and they were able to surgically remove it. And they surgically removed one lymph node. And after that, they were able to test it, and it wasn't in the lymph nodes, which was great news. So I had 30 days of radiation, also at MD Anderson. And after that, they were able to say, okay, we were able to do what we were trying to do. And I've been in recovery since that time. So since March of 2017, I have been on a daily cancer pill that is not chemotherapy. I chose not to do chemotherapy. And I go back to MD Anderson every 6 months, which is a wonderful community of people who are passionate about helping women and men that have been diagnosed and are recovering from cancer. If there's one thing that I will say to all of you, it's that, I feel like an imposter because I've had a really positive experience, and I've had a really, I've just been so lucky. And when I go to MD Anderson every 6 months and I'm surrounded by people that are really struggling, I feel so grateful. And the thing is, stay healthy, get your mammograms, and be a community with each other. I love this program today. So thank you for having me.
Thank you so much, Shannon. Shannon is my daughter by another mother. Thank you so much. And we've been on that journey with her, and she has had a chance to ring the bell.
Yes, and it was fantastic.
Thank you. Thank you for joining us from Plano or Frisco. And our third survivor is going to come to you by a video. She is Janice Workcuff, and she has a story to tell as well.
Hello, my name is Janice Workcuff. Thank you so much for asking me to share my breast cancer story of my survivorship. Thank you so much. Every time I share the story, it's such a healing for me, even after all the years that I have been a survivor. God is so amazing, and I'm so grateful for that. I was wrestling, you know how you just kind of wrestle and kid around with your children. I was wrestling with my son, and he hit my breast accidentally, and my hand rested on a lump. And I knew all through the years of coming up and stuff, I've never had problems with my breast. Some women do, which is called fibrocystic breast, which are kind of fluid filled, and you may feel lumps during your menstrual cycle. I didn't have that, and so I knew that something was wrong. So I immediately I went to the doctor to see about it, and he did a mammogram. I was 32, and so he came back that it was suspicious, but to check in 6 months. 6 months didn't sit well with me, and I asked him, could he do a biopsy? I wanted to make sure, I wanted to have some comfort that this was not breast cancer. He thought that that was a great idea, and he did a outpatient breast surgery, and at that time, it came back that it was truly indeed breast cancer. I was very, very devastated. It did not run in my family. I had not heard about it. This is something you think that happens doesn't happen to you. You hear about it on TV, on the radio, on the internet, anything, but you just don't think that it's going to happen to you. It can happen to you. So I was very proactive about it. I immediately had surgery. I did get a second opinion. He suggested a modified radical mastectomy or a lumpectomy. It was only 2 centimeters, and it was BCIS in situ, which means it was just in place. It wasn't anywhere else. They did a lot of testing and everything. It wasn't anywhere else. And so I got a second opinion, and then my husband and I talked about it, and then I chose to have a modified radical mastectomy. If I had known then what I know now, I believe I worked on emotions, I would have just had a lumpectomy. But I have since had a reconstruction. 3 months after the surgery, again, I'm aware something is going on. And so I woke up and my chest was very red, and it was kind of, tight and swollen. I said, this don't seem right, Again, I'm back at the doctor, something's going on. And so he did a needle biopsy in the office, and about a day or so later, he called me and he said there was a reoccurrence into the chest wall, and that he was going to hit me pretty hard with chemotherapy and chemotherapy first, and then radiation after that. And then he stated to me that the days of my life would be very short. And I just was absolutely, for some reason, that just didn't hit me hard. I said, the days of my life. going to be very short. Oh no, I serve a mighty God. I said, and He's a healer, and I'm going to fight. Like I say, I was young, I was in my career, I was married. I had things that I wanted to do, and I didn't want to just live. I wanted productive living and quality of life where God can continue to use me. So I wouldn't be on vision of what the doctor had said, but I did what I needed to do to be able to live. And they hit me really hard with chemotherapy. I was very sick. Sometimes I couldn't walk, sometimes I couldn't talk, but I thank God for my mother, my mother-in-law, my husband, my family all around me, helped me, supportive friends, they helped me, and I thank God for that. And then I had radiation after that. And again, that was just, all of that was just so very hard for me. And when I was sick, I heard loud and clear that God said, this is not going to be unto death. This is going to be for you to help so many people when you get up from here. And I would get up from there. I said, oh, I'm going to get up from here. And when I get up, I have had skates on ever since, I'm telling you. And so my days have turned into months, and my months have turned into 32 years. So I encourage you to take care of yourself, just continue to do preventative treatment. And that, when I say preventive, I mean um, eating healthy. Try to eat healthy as possible. More fruits and vegetables. You hear that all the time. All this fast food and fried food and all that is just not good. So make sure that you're taking care of yourself, keeping your weight down. Obesity is one of the risk factors. So obesity, and it's not easy, but start somewhere. Start somewhere and maybe just take small steps. But we're moving more toward preventative treatment because, see, we know how to take care of ourselves. Right now, it's just a lot going on, but take care of yourself. And thank you so much for allowing me to share my story. I'm so excited to be able to do that. Thank you so much, and take care.
Okay, I'm sorry, I was muted. We want to ask questions now. I hope you've gotten plenty of information, and we have our panelists right here, Dr. Oki and Dr. Burns, and they would like to answer any questions that you have. I'd like to start off with one. If Dr. Oki, if you could talk to us about what one of the survivors said. Ms. Williams, she talked about having triple negative breast cancer and what that means for us in our community.
Okay. So, like I said before, there's different types of breast cancers, right? There's ones that are fed by estrogen you make in your body, but there's ones that are negative for estrogen receptor, meaning that they're not fed and they don't grow based on the estrogen you make in your body. They're also negative for something called HER2. And so triple negative breast cancer, though it's only seen in about 20% of breast cancer, it's actually seen at a higher incidence in African American and Hispanic women, and then they're noted to get the triple negative breast cancer also at a younger age. Unfortunately, triple negative breast cancer and HER2 positive breast cancer are the two breast cancers that are noted to be the most aggressive. However, for the HER2 positive breast cancer, as you can tell from the first survivor who was triple positive, HER2 positive breast cancer actually has great treatments now, targeted therapies that make it so now it's actually one of the better breast cancer and is more curable. However, we're still working on triple negative breast cancer. And we're actually finding in triple negative breast cancer that we can't just say triple negative breast cancer is one breast cancer. There's actually within triple negative breast cancer different subsets, and we're actually seeing even within African Americans and Caucasian women that the triple negative breast cancers are actually different. So we're now trying to actually tailor through clinical trials different treatments for the different types of triple negative breast cancers that we've seen. One of the main pioneers of triple negative breast cancer, Stacy Mulder at MD Anderson, actually has a clinical trial where you can treat the different types of triple negative breast cancer with different therapies and not just chemotherapy. And so triple negative breast cancer is the more aggressive type. We are working on figuring out a way to try to treat it differently and not call it all one breast cancer. I think that was the issue we had with it before and why we weren't able to cure it as well. Now we're figuring out that they're different types and we're trying to treat them differently. However, again, if it's caught very, very early, with your screening mammograms, a lot of times it's highly curable. So again, I'd like to encourage people to get their mammograms.
Yes. Can
Absolutely.
you one more moment on participating in studies?
Mm-hmm.
I know for years we've been very, very skeptical about participating in studies.
Mm-hmm.
Because we have triple negative breast cancer and it is particular to us,
Mm-hmm.
participating in those studies can be very helpful to us, to ourselves, as
Mm-hmm.
well as to other women in our families.
I see. So, so clinical trials in general have a skepticism in the medical community overall and patients. And the reason for that is because a lot of people think that clinical trials means that one person may get the drug while another person may not. Some clinical trials are like that. However, due to stringent policies and, something called the Investigational Review Board, a clinical trial will never ever let you get subpar therapy, meaning it's always, even if you compare to someone who's getting the clinical trial drug versus not, you will always get the standard of care therapy or the recommended therapy as if there was no clinical trial. So I just wanted to put that out there, that clinical trials never ever mean that you're ever going to get subpar therapy. It just means whether or not, usually, adding a different drug or the investigational drug may make the outcome better, which, again, that's investigational. We don't know. Again, there's a lot of stringent policies now to make it so that, patients are well informed of what they're getting into when it comes to clinical trials. And then so I highly encourage people to get involved, because we do have an under enrollment rate with African Americans compared to Caucasian women. So we're not represented, right? So our tumors are not represented. It was just 2 months ago that Yale published that, we just found this out 2 months ago, that triple negative breast cancer in African American women are not the same as in Caucasian women. Just 2 months ago, we just figured that out. Based on the biology, right? So now Yale can tailor a study to target African American women's triple negative breast cancer now, just because enough women enrolled in that study. Again, so any study, also sometimes clinical trials does not just mean, getting a drug. Any opportunity you have that, any blood draw that they can do, or what we call tissue banking. So the biopsy they already had to get, or the surgery they already had to do for your cancer, if they're asking you, can we study it? It's not anything extra you have to do, but it does help to forward medicine and help to get us more educated on your type of cancer, and especially the disparities in the biology of cancers between African American women and Caucasian women, or people with different stages or different types of breast cancers. So I highly encourage people to, just talk to your doctors about it, and then, get well informed about the clinical trials and consider participating.
Thank you.
That's great information.
That's great information. Dr. Burns, can you talk a little bit about some of the breast lesions that people see that are before 35, and oftentimes how they get into the office? Sometimes we see teenagers, sometimes young adults, and they're very, very frightened about the lesions that they have. Is there anything that we can do as clinicians, or that patients can learn, so that they are not apprehensive about coming in and getting those lesions evaluated?
Well, the apprehension is understandable, but what everybody needs to understand is the earlier you come in, the faster we figure it out, and the faster you start getting treatment if that's necessary. So when you're young, the majority of the lesions that you feel have to do with your cyclical hormonal changes, or sometimes your diet. I noticed a pattern when I was practicing in around finals time, that people would come in and they would complain that their breasts were hurt. All of a sudden, I'm having this breast tenderness, or I feel a lump. And it has to do with increased caffeine intake. People were drinking more coffee, more energy drinks, trying to stay awake to study and cram for exams. And caffeine intake, as well as chocolate, is associated with breast tenderness or mastodynia. So your diet does play a role, and very simple things like that can make a big difference. Some people have those same cyclical changes if they have something called fibrocystic changes in their breast that do respond to hormonal changes. Your breasts get tender just before your cycle, that sort of thing. And again, hormonal changes and diet can make a difference in controlling that as well. But if you think anything is different, you feel something different, you think something isn't right, please come in and let us check you. Staying at home, burying your head in the sand, the ostrich approach is never the right way.
Yes. And that is so, so true. Thank you. So what about, Dr. Burns, teenagers with breast masses? Oftentimes they may come in with lesions, and certainly the sizes of their breast are variant, but these are oftentimes things that we get in the office, and we're trying to titrate that. The mothers are very, very concerned about the masses that their daughters are developing. Is there something that we could tell them just across the board that they would be more comfortable with, especially since so many of our girls are playing sports, and they're involved in tremendous amounts of activity where their body weight, their body fat is so much less. And many times the breast is much more protrude. It is more dense, during that time. Is there anything that you would want to tell those mothers or tell those young ladies so that they won't be so apprehensive and wanting to have a mammogram, rather than an ultrasound early on?
Well, mammography is not terribly helpful in young women because of that. Because they don't have a lot of fat in their breast and their breast tissue is so dense, you can't see very well. An ultrasound is a much better way to image the breast when you're younger. And the chances are what they're experiencing is something cystic or fluid filled. And an ultrasound would show that a lot better than a mammogram. Did you want to add anything, Dr. Oki?
Yeah. I think when it comes to younger women, a lot of times there are breast changes again, due to, everything from puberty to, them growing. Yes, you're right that mammography, when their breast tissue is developing, is not as accurate. I think it's something that they can easily just, continue to note, continue to let their doctor know. And then also the doctors can just educate you on, what to be mindful on changes. Very rarely, even with patients who have a genetic risk of higher risk of breast cancer, do we actually see breast cancer at ages in the teenage age. Normally we see it after the age of 25, or actually 29 is actually when we start to screen them for the high risk, what we call high risk screening for the genetic testing. So I think it's just something to be mindful of, something to keep note of, and then to help starting to practice your self breast exams, and then just be mindful of things that are changing. And then it could be end up that these are pre breast cancerous lesions that you need to be mindful of, like the benign lesions as well. So that's just what my recommendation would be.
And thank you. Well, I think we're running out of questions at the moment. I'm sure that we could have many, many more, but I just want to take this opportunity to thank you guys for just bringing all of this information to us and helping people to put away some of their concerns about having their breast exam done, and moving forward using October as a month where we talk to each other about who has what in our families, and also making sure we make a trip as a family to get our mammograms, because we can make the difference in our health. Thank you.
Thank you.
Thank you.
We want to now come to our, so now we've learned all these things, so we've got to have fun again. So Linda, you want to tell us what we've got?
We have lots and lots of winners today. We have, first of all, the random names that were pulled in, I think when you first came in, perhaps. Yes. I guess like raffle tickets or door prizes. So we have 5 of those, and we will be emailing to you your gift/gift card. So please be looking out for that. And young people, we did not forget about you. If you remember last year, you were a key part of our program and our activity, and we had you come up stage. We don't get a chance to see you today, but there were 20 youth who text Y Health to 71441, and we have those 20 names, those first 20 names, and you will also receive a prize. We have your emails as well, so you will receive it through the email that you signed in under. So please look for that. And we've had a great time today. We hope you enjoy your gifts. We also had the Kahoot winners, the top 3, and then we had the scavenger hunt. So there are lots of prizes that you need to, if you're one of those, in one of those 4 groups, the youth, the scavenger hunt, the door prizes, and the Kahoot, please look out for your gift via email. It might not be today, but it will probably be before the weekend is over on tomorrow. Thank you for participating in all of our activities.
And certainly, we want to remind you that we will be getting together next month. And next month is Linkages to Life. And it's about healthy food. You know, in the coronavirus, Pastor Brooks, we have just learned, at first, when it was in March, we were all walking, we were all doing things, we were getting out with our families, spending more time. I thought it was God's way of getting us to kind of slow down and spend more time with family. But as I continue to talk with more and more people, we're doing all kinds of things at home. We've stopped walking, we've gone out, okay, we've started cooking, and we're cooking comfort food because this has been 7 months.
Yes.
So we thought that next month, Sassy Ladies and Bees Girls Foundation would get together and talk about things that we could do to keep ourselves healthy as we're going into the holidays, because our holidays are not going to change. We've got November coming up, we've got December coming up, and certainly we don't want our health to be sacrificed during this time. So you'll see online there on the comments that we already have the flyer for our linkage to life and food for thought. So you already have the number where you can sign in to Bees Health and register. And certainly we're going to get together. We'll have those updates on coronavirus. And I really want to encourage you, if you're going out to a restaurant, please make sure you sit outside with your family and only with the people that are in your group. Okay, so that you're not exposed to other people and other viruses. So we look forward to getting back together. We look forward to sharing all of this information with you and making sure that even though we can't be at Love City, we can still be bumping elbows on Facebook, okay, on Facebook Live, and certainly on YouTube, so that we can be together. Thank you again, Pastor Brooke. Thank you again for Pastor Bridget for allowing us to bring this information to our community. It is truly a blessing.
Absolutely. And we're so grateful that we were able to record it and put it on Facebook Live so people can go back and watch it later as well. And so it was some great information, and we really appreciate the Sassy Ladies for doing this. Appreciate you all doing it. So the next event will be on November 7th at 10 o'clock a.m. And of course, you want to register, text B Health to 71441 so you can get all of your gifts. And then at the end of this, there's a slate that's going to come up. We have some products available, Bees Girls products, to kind of help you get outside. Like we have water bottles, and we have waist trainers, and we have t-shirts, things like that, so that you can get outside and start working out. The weather is really good right now, so you can get out and walk and ride your bike and do some things right now and be cute while you're doing it. So I want to encourage you to get those products as well. So thank you again, Dr. Mott. This has been very informative. There was one question that was missed, but we can either answer it later or you can answer it now. I'm not sure. but it was about calcifications in the breast. I don't know if we mentioned that as well. Someone asked that question about breast calcification. So
yeah, certainly calcifications in the breast are very, very common. Okay, the majority of them are totally benign, but certainly when you're having your mammogram, and as Dr. Burns talked about tomosynthesis, they are doing extra evaluation to the breast to make sure that there is nothing, no stellate areas or anything aggressive. And certainly Dr. Oki will tell us that there are many areas in the breast that have to be rebiopsied because of variants in that. So would you ladies like to speak to those calcifications in the breast as well?
Sure. So yes, I completely agree. Calcifications are very common to be seen in the breast. A lot of times they are benign lesions. Sometimes if we do see, that's why it's good to get mammograms to compare them from the one from last year, because if we see the changes in the calcifications, then that does usually warrant biopsies. A lot of times, the biopsies will come back benign, but sometimes a certain type of calcification can be the early signs of what we call DCIS, or ductal carcinoma in situ, which is a pre-breast cancer. We call it stage 0 breast cancer. And then that's really caught early. And then so a lot of times it's, granted that, they may tell you have calcifications, a lot of times it's benign, but it's reason to continue to get your mammograms yearly so they can compare the calcifications from year to year in case a biopsy is needed to catch things even earlier than actually getting breast cancer.
great. Thank you so much.
All right.
I think that was one other question about different from Tony Hutto. Justin, if you could put that one up real quick. Then, of course, people ask, should men do breast exams monthly? But this is the one that I was, what types of new immunotherapy trials are out for breast cancer?
So immunotherapy right now in breast cancer is actually only FDA approved for breast cancer that has spread, so stage 4 breast cancer that's triple negative. However, both in the early stage now, breast cancer of triple negative type and estrogen positive type, there are clinical trials where they're giving immunotherapy with the standard chemotherapy, right, before surgery. And we're seeing and some of the preclinical studies that have been presented, one was presented actually at the European Society of Medical Oncology 2 weeks ago, and the other one at ASCO back in June, which is the American Society of Clinical Oncology. And that had shown actually that we're seeing what we call more pathological complete responses. So of all the patients who were treated, close to 70 to 80% had no cancer at the time of surgery. All they had to remove was the bed the tumor was in, compared to what we normally see with regular chemotherapy, which was about 50% we see that. So we are seeing some promising results with that. It's not quite FDA approval yet because they want to see long-term effects. However, in the preclinical setting, we're seeing that that is a possibility. And MD Anderson, we do have 2 of those trials.
Awesome. Well, thanks again, ladies. And we look forward to next month, November 7th. And until then, stay healthy and stay safe.
Thank you.
Thank you.
Thank you.
Thank you for having us.
Thank you.